Hello and welcome to NAFDAC and Your Health. My name is Tosin Omolaja. This is the program that brings you all the important information you need to know about NAFDAC, the agency saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome.
Today, we joined the Director-General, NAFDAC, at a press conference in Abuja to mark her 4th anniversary in office, highlighting some activities, challenges and achievements of the agency under her leadership.
This press conference offers a golden opportunity for us to take stock of the flurry of events, regulatory activities, challenges, opportunities, and achievements in the last 4 years. The goal of the last 4 years, like I said, is to safeguard public health, the health of Nigerians, to strengthen the industry, to pursue customer-centric regulatory activities, and play a pivotal role in the growth of MSMEs, and to enthrone top quality management system, QMS, and also to strive towards attaining World Health Organization WHO level 3 or maturity level 3 in the global benchmarking audit.
Speaking at the press conference, Professor Mojisola Adeyeye gives an insight on the state of the agency when she took over its leadership.
Permit me, therefore, to take a cursory look at the situation in NAFDAC on 30th of November 2017, when I took over the helm of affairs. Regrettably, I met an agency whose regulatory activities were at the lowest ebb. Staff morale was low, glaring cases of indiscipline and labor union strikes, as well as general lack of administrative focus and direction. I knew the regulatory framework was weak and therefore needed systemic overhauling. I quickly realized that it will take putting in place 7 internationally defined building blocks that are based on World Health Organization recommendations in order to strengthen the agency.
According to Professor Adeyeye, officials of the World Health Organization WHO were in the country to audit activities of the agency.
This year, the WHO officials were in the country July 5 to 9 and then October 15 to audit our activities, and it is virtual. And I can report back to you that they were glad about what they saw on the ground. In January 2018, NAFDAC has 186 recommendations to satisfy. About a month ago, October 15, the agency had fulfilled all the recommendations. This 186 is part of the 168. We had 7 regulatory functions that have been assigned different numbers of recommendations. What did we do in terms of national regulatory system? We instituted strong governance. Under my leadership, the agency has been restructured and expanded from 13 directorates to 18 directorates, including the FCT. The 5 newly created directorates are the laboratory services, the drug laboratory services, legal services, Kaduna area laboratory, Agulu zonal laboratory, and the food registration and regulatory affairs directorate. I met a 3.2 billion naira debt but confronted this big challenge with great resolve to change the narrative by working relentlessly with the Finance and Accounts Directorate. The following changes took place within a year. By 2018 November, bringing financial sanity to the agency by stepping down all fictitious claims, introducing budget discipline to all financial activities in NAFDAC, reducing the debt profile of 3.2 billion naira to 0 as at 20th November 2018, introducing cost-effective measures, thereby steadily increasing the agency's cash position, putting both human and material resources in place, and these have resulted in boosting the agency's internally generated revenue significantly and also reduce recurrent expenditure drastically. We improved our internally generated revenue 3 times in 2018, more than 3 times in 2019, and about the same in 2020. We did payment of 40 million naira severance allowance for the first time in the history of the agency, or recognition for good work done. We discovered and recovered about 106 million naira that were erroneously credited to another MDA in 2015. We recovered, the Ports Inspection Directorate recovered about 533 million naira from evaded administrative charges that were not paid 2014 to 2017. We completed the management account for year 2016 up till date. There was a backlog. We put in place machinery to ensure that all statutory deductions are remitted in due course, while contractors and staff claims no longer suffer unnecessary delay. Under my leadership, staff training, capacity development have been great priority in the agency. No fewer than 3,600 staff have been trained and retrained in the last 4 years. With a transparent and quality-driven work environment that is expected of a regulatory agency, our staff are now well motivated, disciplined, and more dedicated. Since 2018, 40 utility vehicles that are critical have been purchased, while 73 vehicles are being processed by the agency as we speak, that they have been approved by FEC. These vehicles are Hilux vans for the state offices for the operation of the agency, and some of them are vehicles for staff. It is my belief that every state should have at least 3 utility vehicles for operation. There have been some allowances that were not in existence before. We are pursuing the possibility of creating another salary structure for the staff. COVID-19 pandemic didn't help us in this our pursuit. While we are also pursuing the National Salaries and Wages Commission for possibility of getting additional allowances for our staff. Why? Because our staff deserve it. What of conducive environment for regulatory activities? Going around many states and zonal offices in the country, I saw a pitiable environment to attend to customers that have negatively impacted on staff productivity. Therefore, from our prudent financial management that came from quality management system, we budgeted for construction of some zonal state offices. These offices are under construction or near completion, and these are Kebbi, Sokoto, Yobe, Kwara, Ogun, Osun, and Ebonyi state offices. 7 are being constructed as we speak. In addition to this, the NACO Port Inspection Office in Ikeja is under construction. We're expanding the Yaba Drug Laboratory, part of our quality management system and global benchmarking requirements, and upgrading the biologics vaccine laboratory. Especially with the pandemic era, the government also came to our side to fund part of the building of that laboratory or upgrading of it. For ICT, there was also reconstruction of our website. It is extremely important for regulatory agency to be transparent. And the only way to be transparent is to put on your website the essential processes, activities that are going on. Online registration was initiated in 2019, while 350 computers were acquired, and another 400 computers will soon be delivered. Why do we need computers? Because we're a regulatory agency, because we have thousands of MSMEs, and there's no way that we can hasten, improve the rate of approval of products without having computers. One of the key expectations of a regulatory agency is information dissemination to the public to effectively safeguard the health of the populace. NAFDAC continues to engage and enlighten the public on NAFDAC's activities about their health. In the past 4 years, the agency has engaged 18 media partners, which include 4 television houses and the FRCN.
NAFDAC and your health will be back in a moment. Please stay tuned.
Beware. Fake or damaged drugs have put many people in serious health harms and have killed many others. But you can protect yourself by seeking professional healthcare advice when you feel unwell. Buy drugs from only licensed pharmaceutical outlets and make sure you check the packaging for poor condition, spelling errors, and unclear labelings. Also, check NAFDAC registration number, batch number, the expiry date, manufacture date, and manufacturer's address before paying, and always collect a receipt. If you suspect a drug to be fake or damaged, report immediately to NAFDAC on 0800-162-3322 or send an email to sf.alert@nafdac.gov.ng. Protect yourself and your loved ones. This message is brought to you by NAFDAC with support from WHO.
Welcome back. If you are just joining in, you're watching NAFDAC and your health.
For our regulations to be regarded as official government documents, NAFDAC needed to update and gazette her regulations. This was achieved in 2021 through NAFDAC's Governing Council with the approval of the Honorable Minister of Health. 28 regulations were gazetted, and we have that on our website on the home page. Detection and elimination of substandard falsified medicines. The agency has been highly proactive and vigilant in this regard. In our determined effort to combat substandard falsified medicines, illicit drugs and chemicals, as well as unwholesome foods, the agency has deployed multifaceted strategies, which among others include enforcement of regulation and control of the active pharmaceutical ingredients that are imported into the country in order to make sure that they meet the required standards for manufacturing of drugs and reduction in the number of registered imported products to encourage local manufacturing and innovation. Our pre-shipment clean report of inspection analysis of imported medicines has been overhauled. Other similar measures include deployment of cutting-edge monitoring technologies, risk-based laboratory testing, public enlightenment on substandard falsified medicine, interagency, interprofessional collaboration, and community efforts, and continuous post-marketing monitoring of quality of drug substances. The launching of pharmaceutical traceability strategy was done in October 2020, and it is the first step in positioning NAFDAC to be a leader in driving traceability of pharmaceuticals in Africa. NAFDAC has developed a 5-year traceability implementation plan in line with the objectives of the Nigeria Pharmaceutical Traceability Strategy to achieve supply chain visibility and strengthen its pharmacovigilance activities against the scourge of substandard and falsified medicines or medical devices. NAFDAC has put a premium on local manufacturing of our regulated product to ensure that Nigeria will have drug security and turn the tide from 70% imports to about 30% imports by the year 2025. As a continuum of ensuring that substandard falsified medicines and counterfeited products are removed from the market, the agency has procured 40 units of detection devices that can be used for on-the-spot detection of falsified medicines. Each is about $57,000. Each is about $57,000. And we have ordered 40 that are on their way. It is the money that you save that you have access to spend on needs. When you take medicine, you may have side effects. How do we record the side effects? So that instructions that came with that medicine could be modified. That is part of why adverse drug reaction reporting is extremely important. The agency has 119 recommendations to meet in order to satisfy this. Today, we have met those recommendations, 119. To effectively detect adverse drug reaction as well as identify and mop up standard, substandard falsified medicine in circulation, we have adopted electronic reporting of ADR. The laboratory services situation in 2018, about 80% of our equipment were not working in 2018. And with the situation, ensuring the quality of medicines that are released or approved for use became challenging. Since 2018, NAFDAC laboratories are changing rapidly with improvements in new laboratory equipment and supplies. Over 2 billion naira worth of equipment have been procured.
Under her watch, the agency has received several awards and commendations for the excellent regulatory work it has done. In a bid to improve public health, the Director-General, National Emergency Management Agency (NEMA), Mustafa Habib Ahmed, paid a courtesy visit to Professor Adeyeye, the Director-General of NAFDAC, to request collaboration of the agencies towards the delivery of quality medicaments to persons affected by disasters in the country.
By Director-General NAFDAC and members of her management team during this important visit. Our visit today is aimed at exploring areas of collaboration between NEMA and NAFDAC towards safeguarding public health and improving health service delivery to the most vulnerable groups of persons in times of crisis, especially for internally displaced persons and other people impacted by disasters. Distinguished ladies and gentlemen, permit me to say that upon my resumption of duty at NEMA, I realized that our vision of paradigm shift towards disaster risk reduction and building of national resilience will not be achieved without the support of partner agencies like NAFDAC. I therefore use this opportunity to seek for support and collaboration in this regard for more effective care to vulnerable persons and those affected by disasters. I once more thank the Director General and the entire management of NAFDAC for the warm reception, and we look forward to a new vista of mutual support and collaboration between NEMA and NAFDAC.
Responding to the request, DG NAFDAC assured the readiness of the agency to collaborate with NEMA.
Displaced people, for one reason or the other, are protected with shelter, food, drugs, medical devices, hospital care, and these are examples of the crossroads where NEMA and NAFDAC meet, or where we should be meeting. And whatever we can do as an agency, we will do.
Time now for our weekly bulletin on NAFDAC's regulatory activities.
NAFDAC DG encourages trade and investment in pharmaceutical and food sectors. The National Agency for Food and Drug Administration and Control, NAFDAC, has stated that products under its supervision being traded are critical to the long-term viability of bilateral agreements. The Director-General of NAFDAC, Professor Mojisola Adeyeye, who spoke at the second Pakistan-Africa Trade Development Conference held in Lagos, insisted that without quality trade, the Pakistan-Africa trade development will be short-lived. According to Professor Adeyeye, regulatory agencies are supposed to be universal in terms of what they expect from their clients or stakeholders. The mandate of NAFDAC is to control and regulate importation, exportation, manufacture, and distribution. She also said that the Nigerian government could relate to the importance of exchange of cultural and regulatory ideas, adding that NAFDAC welcomes trade and investors and has created room for partnership in terms of pharmaceuticals and food. According to her, NAFDAC has improved its regulatory control over the last 4 years, and the World Health Organization, WHO, recognizes the agency for that, because without a strong regulatory agency, there cannot be good trade. She appreciated the Pakistani Minister of Commerce and Investment for organizing the event and assured her of her readiness and free access to encourage collaboration between both countries. That's it on NAFDAC Update. You've been updated.
That's it for today. Make it a date, same time, same station, next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
NAFDAC prioritizes customer satisfaction, which is why our motto says we are customer focused, agency minded. Kindly visit our website to fill a short customer satisfaction survey to help us serve you better. Remember, COVID-19 is real. Please ensure you and your family follow the safety measures as outlined by the NCDC. Stay away from crowded places as much as possible. And if you must be out there, please wear a face mask. Wash your hands regularly with soap and water and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. See you next week. Stay safe.